this slide is a list of the attributes of a compassionate leader from the King's Fund. So I didn't really know about the King's Fund until I met Lawrence. So the King's Fund is an independent charitable organization working to improve health and care in England. And what strikes me again and again when we're looking at compassionate leadership, if you look at the last one, most importantly, self-compassion, self-care. This is the foundation. And self-care arises from self-compassion, and then self-compassion sustains compassionate leadership. It creates that psychological safety that we were kind of talking about: honesty, communication, listening. I mean, all of those attributes come from being compassionate. And when we're able to communicate authentically about our needs and our situation, it increases our efficiency and effectiveness of interactions, getting to the root cause of the issue. Next slide, please. So some of the things that you listed are called, emotional contagions. We're all called to lead from wherever we are in the health system. This is possible because leadership begins with how you lead yourself. You have impact. You are an influencer. Your words and behaviors and your being can be contagious. As a powerful node in a network of empathetic beings, your emotions can go viral. We are all, in fact, interdependent leaders of our health system. So the examples of emotional contagions, whether they're conscious or unconscious, are acts of sharing our emotions, whether it be verbal or even physical expressions. So for example, projecting being happy or calm, opening up our arms instead of crossing them, validating, attuning, being open-minded. Basically, what I want to say is compassion is contagious. People are looking for adult co-regulators. That's what we can bring to the table. And how can we cultivate the ability to be co-regular? It's practice. With every human, we have the ability to forge relationships of trust and building rapport. I mean, many of us do that on teams with our patients. This is the basis of what we bring to the table with compassionate leadership. Next slide, please. And so when we bring that compassionate leadership to the table, our goal is to attain this circle of life, a virtuous cycle of compassion, because this is a healthy culture in which we can thrive. It allows us to absorb, ebb, and flow the energy from this virtuous cycle of compassion. I know sometimes we encounter negative emotions or words, and if we're able to kind of name that contagion, reframe it, allow it to pass, we don't absorb the energy. And I know, understandably, this is easier said than done, but practicing this skill will allow us to attain that self-compassion, which will further our goal of virtuous cycles. And it's definitely not about perfectionism. I think that's something that I sometimes kind of tell myself, I'm not striving for perfection. I'm striving for, an understanding, humanity. Next slide, please. So let's put our words into action. I really like this, this cartoon picture because, it really shows, compassionate leadership in action. When there's storms, so the storm is, we come into a board meeting, a patient encounter, our partner has a concern, maybe my child is upset, but it meets our calm, and we provide that co-regulation. Some of the things we do, we sit down, we create a safe space, listening, allow for authentic communication, naming the emotions. Yeah, some of them are going to be really crappy, but I think we have to validate and attune to that, help to reframe it, giving choice and even apologizing for the suffering.